Dr. Adam Kopsky from Advanced Road Medical, and today I wanted to talk about a very common spinal condition that happens as you age and we have stress on our spine. And you'll see right in front of me, I got this, what we have individual segments of your spinal vertebral bodies here. As we age, we have 4 different phases of spinal degeneration, and you all have heard of arthritis. Well, this happens in our spine as well, and we call it spinal degeneration of the spinal disc. So you may have heard it, degenerative disc disease is DDD, and also degenerative joint disease that happens in the back of the spine. So what actually happens, if you see here, so this is textbook, and if I'm going to pick this up, you see how we have a nice big disc here. This is what our spine should look like as we're born and we're in the first decade of life, so we're about 10 years old, nice and healthy. But as we get to the second, third, and fourth decade of our life, and as we had stress on our spine, you'll see how this starts getting to where it's nice and thick here, to where it starts shrinking in phase 1, and as they continue, we get to phase 2 and 3, you get all these nasty bone spurring. And then right here, you see you don't have much cushion at all. So believe it or not, this doesn't always correlate with pain. Now it can, but the good analogy I like to say is if you go to the dentist and you have a normal routine dental work on your mouth, what happens? We prevent those cavities from happening. So similar in our spine, we want to make sure if you're at a phase 1 or 2, whenever you come here, to reverse this. Okay, because what happens when the dentist, you come in, you get that cleaning, they want you to come back in 6 months to prevent you from getting to a further degenerative disease in your mouth that costs more money and it's harder to manage and deal with and causes more pain. So we want to make sure we keep the spine free of degeneration and just like your mouth free of cavities, and reverse that and come back to here. So I know this is a lot and I didn't want to take up a lot of your time, but this is just what occurs, when we get to see patients that are 50, 60 years old, and typically we get them at a point here where we're trying to reverse this process and get your quality of life better. So come back for next week, and I'll go over about bulging and herniated discs more in depth on this. So I hope this is very informative. As always, please ask questions in the comment section if you have any questions at all. And as always, hope you have a great week ahead. Thank you.